Vanishing twin syndrome, a very funny condition whereby you get pregnant with the twins, they all develop together, they grow together, but on the journey of pregnancy, one of the twins disappears, or in other words, you get a miscarriage of only one twin, and you are left with only one twin surviving in the womb. I know this is a bit interesting, right? So stay tuned to this video until the end. Vanishing twin syndrome. This is a medical condition whereby you get pregnant very well, you conceive normally with the twins, and these twins starts to develop together and grow together. But in between the pregnancy journey, one of the twin decides to disappear. Well, you get a miscarriage of only one twin, leaving the other surviving and doing well in the womb. This is a condition that the main cause it's not very well known, but it is believed that DNA abnormalities plays a major role in causing this condition. This condition does not pose any risk to the surviving child if it occurs in between 0 to 17 weeks of gestation. But if it happens you suffer this condition when you are 17 weeks plus pregnant, they pose risks to the mother and also to the ingrowing fetus. There are 4 complications, there are 4 risks that are associated with this kind of pregnancy when it occurs beyond 17 weeks. Number 1, we have preeclampsia or blood pressure in pregnancy. Number 2, we have intrauterine growth retardation. What this means is whereby the child or the fetus does not grow well in the uterus, and this may lead to you delivering a child who is an underweight. Number 3, we have perinatal mortalities. Well, in other words, you can suffer intrauterine fetal death. We also have another complication whereby you may go into labor very early, or in other words, the preterm labor. Before you get into full term, you start developing signs of labor and you end up delivering a premature baby. Those are the complications that are associated with this condition when it occurs beyond after 17 weeks. When this pregnancy or when this condition occurs when you are below 17 weeks, there are high chances that the surviving fetus will continue to grow and will deliver normally. In most cases, when this condition happens, you suffer the normal signs or you suffer the normal symptoms of any other miscarriage, whereby you experience pervaginal bleeding or spotting, you suffer abdominal pains, and also you suffer back pains. But the bleeding does not go for a longer time, or this pain does not persist. And this makes most of the mothers not to go seek medical attention. So, you might be asking what happens when now this one twin disappears. What happens is this. When this condition sets in, the tissues of this disappearing twin, they are absorbed by the mother, or they are absorbed by the developing fetus in the uterus. In most cases, to mothers who suffer this kind of a condition, most of the times we deliver, and in the placenta, we end up finding some tissues of the disappeared twin in the already delivered child. So that shows you that the developing fetus or the baby that you already delivered is the one that absorbed the tissues of the other twin. Now, people are asking on how they can prevent this condition from taking place. Remember, we said that this condition occurs as a result of DNA abnormalities. And since there is no way you can prevent the abnormality from taking place, then it simply means that there is no way that you can prevent the vanishing twin syndrome from taking place. Okay. One way on how you can tell whether you suffered this kind of condition, number one, it's whereby you can have an ultrasound, and also you check the HCG. When you take an ultrasound earlier, before this condition sets in, most of the times you are told that you have twins in your womb. But later on, when you take another ultrasound in future, you are told that you only have one intrauterine single fetus surviving. Most of the times you may wonder, or maybe you may dispute the results. Because if maybe you had the ultrasound before 17 weeks or in other ones before this syndrome occurred, then the sonographer automatically will detect that you have twins, and that's the truth. But in future, or maybe when you suffer these signs and symptoms of miscarriage, the bleeding, the pain and what, and then you decide to go into the hospital, if this condition has already taken place, the sonographer will only detect one child. Then this means that you suffer this condition. The other way is by checking the HCG hormones. HCG hormones is the hormones that helps you or helps us to detect that we are pregnant even when we take a test. This hormone plays a major role in sustaining the pregnancy together with other hormones. So when you are carrying triplets or you are carrying twins, these HCG hormones tends to be so high. So if maybe at the first we took or we checked for the beta HCG levels and we found them they are very high, then again we repeat the HCG levels and we notice that the values has reduced, then that one is also another sign that you have suffered this vanishing twin syndrome. Most of the times, I'm sure you have ever heard people say that they are carrying twins. Maybe they went and had an ultrasound very early during pregnancy before this vanishing twin syndrome occurred. On the process, they suffered these signs of miscarriage. That is the bleeding or spotting, the abdominal pains and what. But because these symptoms are very mild, they fail to go to the hospital. When they go to deliver, they only deliver one child when they already knew that they had an ultrasound and they were told they have twins. Many of them tend to dispute the outcome. But the truth is, yes, maybe you had the twins, but this condition took place. So, it is not an error of maybe the midwife telling you that you only have one child when the ultrasound has shown that you have twins. Such complications or such conditions exist. But allow me say that suffering vanishing twin syndrome does not prevent you from getting normal pregnancies or getting children in future. Because these are conditions that you can suffer and still get pregnant. Another main question is now, after you realize that you have this vanishing twin syndrome, how do you manage it? Our management targets on making sure that the remaining child has developed well and you have delivered successfully. What we do is, since there is no specific management for vanishing twin syndrome, we manage the complications that comes up with it. If maybe you come into the hospital and you suffer blood pressure, the treatment that we'll give is to try to manage the blood pressure to go down. So this is a problem that does not have a specific management, but we try to manage the symptoms or the risks that comes up with it. So if maybe you have ever carried a pregnancy, first weeks of pregnancy you are told you have twins, but when you went to deliver, you ended up delivering only one child, then this condition is an answer to you. And in most cases, vanishing twin syndrome took place in your body, but you didn't realize it. If this is the very first time you are coming across this channel, kindly subscribe, comment, like, and share the video that it may help many. Until next time, I sign out.